Now, when do microorganisms become pathogenic or cause disease to our body? The pathogenesis of bacterial infection includes initiation of the infectious process and the mechanisms that lead to the development of signs and symptoms of the disease. So this is brought about by a lot of factors, no? And we will be talking about how they exactly cause disease when we discuss the specific bacteria, okay? So when we say infection, this refers to multiplication of an infectious agent within the body. Take note that multiplication of normal flora is not considered infection. But when any microorganism enters a site that it is not supposed to be in, even without symptoms, that is considered an infection. Okay? I hope that's clear. Now, how do infectious bacteria enter the body? Or how do they enter a site where they are not supposed to be in? So the most frequent portals of entry are the sites where mucous membranes meet the skin. No? Example, the respiratory tract, the gastrointestinal tract, even the genital and urinary tracts. Also, breaks in previously intact areas like cuts in the skin or burns or other injuries. These are also common sites of entry. Remember, it is important to know the common portals of entry of specific bacteria so that we would know how infection can be prevented. Of course, bacterial virulence factors greatly influence how sick an infected person will be. So, factors that increase the virulence of bacteria include adherence factors. In fact, adherence is the first requirement for a pathogen to successfully cause infection. So, example, E. coli have pili or fimbriae, and the lipoteichoic acid and the protein F cause streptococci to adhere to buccal epithelial cells. Another factor is the invasion of host cells. Also, the production of toxins and enzymes that degrade tissue. So these toxins, for example, remember the disaccharide units with the crown and the fancy headdresses in gram-negative bacteria. So they are endotoxins. Exotoxins naman, these are produced by both gram-positive and gram-negative bacteria, okay? And they are frequently controlled by extra chromosomal genes like the plasmins, or if it has been previously infected by bacteriophage, such as those secreted by Corynebacterium diphtheriae, remember? Okay, so we also have antiphagocytic factors, such as the capsule in Streptococcus pneumoniae and Neisseria gonorrhea. So these capsules prevent the bacteria from being phagocytosed by host immune cells. And then we also have antigenic heterogeneity. For example, Salmonella species and Escherichia coli have the O and H antigens. And we have bacterial secretion systems. So these are for the transport of proteins that make up the pili or flagella. Remember the pilins and the flagellins? And even the secretion of enzymes or toxins into the extracellular environment. So all of these contribute to how virulent a bacteria will be and how much damage it can do to the host that it has infected.